Did you know that according to the CDC in 2013, 64.4% of the 1.4% of births that took place outside of a hospital took place inside of a home? Home births often happen by choice with the help of a midwife. This choice has made the demand of midwives in the medical career field rise within the recent years. Having a midwife help assist you with the birth of your child can have a few differences than having an OBGYN. This includes whether you want to have a natural birth, how you can pay for the services, and the difference in your prenatal and postnatal care. To have a natural birth means to have little to no medical interventions, which include epidural for pain and surgery, such as C-sections. Midwives are often chosen by pregnant mothers if they would like to have a natural birth. This is because midwives believe in having the birthing process take place as naturally as possible, according to the midwives' model of care. Midwives can assist with a mother's natural birth in the comfort of her home, a birthing center, or a hospital. For this fact, midwives are a little more versatile in terms of their work environment than an OBGYN. Midwives would offer more non-medical help when it comes to the birthing process, such as taking a hot shower, which can help with the pain, moving around the room, and bouncing on an exercise ball, which can help move the baby further down the birthing canal. And they can also help with emotional support if needed. As most of you should know, having a child takes a lot of money. From the time that you find out about your pregnancy to the day they move into their college dorm room. Some parents tend to choose an OBGYN as their doctor because they think that that's all their insurance can offer. However, I would like to inform you that according to AmericanPregnancy.org, most insurances such as Medicaid offer services of midwives if within a hospital. Midwives will also offer payment plans for their services if it takes place outside of a hospital, which is a huge difference from having an OBGYN. This is because most OBGYNs in hospitals simply cannot take your case if you don't have insurance due to hospital policies. One of the main differences between having a midwife and an OBGYN is the time that they can spend with you. OBGYNs tend to have a larger caseload than midwives. This is simply because most people have their children in hospitals and they want a doctor to deliver their child because in society it's perceived to think that doctors know more. But with the major difference of how much time a midwife can spend with you can have a positive effect on your prenatal and postnatal care. For instance, midwives have more time to give counseling on different subjects that affect pregnancy, such as nutrition, exercise, and the emotional changes that women go through during pregnancy, according to AmericanPregnancy.org. Also, midwives can make home visits after you give birth to help with breastfeeding if you choose that way of feeding your child and any other questions or needs that you have. Midwives can also give checkups for both the mother and the child. And this differs from having an OBGYN because you have to go to your OBGYN to get seen or have your questions answered. But your midwife has the option to come to you, which can make people feel more comfortable being in their homes. In conclusion, midwives and OBGYNs work side by side to help patients bring their bundles of joy into this world. However, it's the differences that set them apart. These differences include if the patient wants to have a natural birth or with the help of medical interventions, how the parents decide to pay for it, and the amount of time that you want your provider to spend with you. During prenatal and postnatal care, becoming a mother, whether it be for the first time or the fifth, can be hard. However, midwives can make it a little less stressful, in my opinion, by following the midwives' model of care, which is monitoring the physical, psychological, and social well-being of the mother throughout the childbearing cycle. Thank you.